We always do sessions and we dive into what you have to study, the topics, pharmacology, psychiatry. But I noticed that it's important that we also work on knowing what to do so that we will be well prepared to pass the NCLEX with ease, especially for people who may have attempted already and they may be anxious because it didn't go well. I hope that this session will be a blessing to you. And remember that this time, you're not just going, oh, I'm going to try and see. No, you are preparing yourself very well and you will win. So, yes, as I said, this time you are not just trying, you are training to win. So, we'll go through this roadmap. We'll cover a bit about all that you need to know about the NCLEX. Why do people fail? And we'll go through how you will not, because you get all the strategies. And then we'll dive a bit into the power of clinical judgment. We go through some smart strategies for your next NCLEX success. And if you stay to the end, there are some freebies that you will surely love to have. So let's dive right into the 10 must-know hacks to pass the NCLEX with confidence. So here at MedCognito, we always want to make things simple for you. So we'll use this mnemonic, be confident. That's the MedCognito NCLEX strategy. So B, you begin with the right nursing body. As I asked earlier, some of you had already started like with your processes. So you choose your nursing regulatory body, so where you want to practice. So if you are in Canada, we have CNO for Ontario, we have BCCNM for British Columbia, we have even CRNA for Alberta. In the US, we have New York State, Texas board, and all of that. So you should know that different boards have different requirements. Some may require even English testing and others may not. So you choose carefully and go to the website, read every detail before applying, because you want to be sure that even where you want to practice, if you're an internationally trained nurse, do they accept that? Do they accept international educated nurses? And then go through every bit of the application, because you don't want to get to a point and then you get stuck. And then it's important that you register with Pearson VUE, you create your account. This is the website. And I put these figures, at least so that if you are yet to do it, you have an idea of the financial implication for Canada, exam fee of 360 CAD. And if you are an international graduate, you have an additional international fee. And then for US, so this is just a rough, so you guys have a rough idea, US 200 USD. Then if you're an international graduate, you have the international fee, 150 USD. So know that there is some financial implication. So B, and now we at E. So evaluate and verify your credentials. This one is very important because for you to be allowed to write, they want you to prove that your nursing training in your home country meets the US standard, meets Canadian or even maybe Australia, if that's where you want to go. And for Canada, you use the NMAS. So this is the website. You go there and then you upload all the documents that they need. They have to check your transcript, your license, verify your identity, and all of that. So there may be a lot of like some back and forth. So it takes some months. So if you plan to do it, you have to go through the process early so that you do not have any undue delays, which will even increase your anxiety, especially if maybe you have even already relocated and all the stress that comes with it. So please, you always have to start it early. And for every document, make sure you are keeping your copy so that if you have to produce any document at any point in time, you will be able to upload it. So C, so BE, confidence. C, it's very important that you create a realistic and focused study plan, because by failing to prepare, you are preparing to fail. I always say this. And if you know how you study, you know your strengths, you know your weaknesses. So be realistic. Somebody may say, oh, I really need to write it. And they may choose maybe 4 weeks, but ask yourself based on your family dynamics and what your current circumstance, can you get through with this exam preparation within 4 weeks? You have to be like true to yourself.
Mm-mm.
And choose the right steady period, the right steady plan. Because you are investing in it, you are registering, and you don't want to just, okay, I'm just registering, and then you just going to give your shot. But it's better to be well prepared and then get the right timing for yourself and then go put in your best, knowing that you surely make it. So it's important that you don't waste time. So that is why, like here at MedCognito, we have great resources like Steady Planner, practice questions, and in-depth tutoring so that wherever you are weak, you can sharpen that. And then you also have support. So you don't have time. So this is not, it's not like nursing school that you have all the time to go through everything. You have to do tailored studies. And then there are also other great resources, books. Sundays is good if you want to polish a bit of your content. Sundays will help. If you want to do more practice questions, we have practice questions as well and mock exams. I'll be sharing with you with time. But UWorld will also give you a variety so that you can time yourself and keep practicing. Because you want to keep practicing, the exam becomes your default. That when you sit on that day to write exam, it will be like any other day, and it helps to curb your anxiety. So get a steady plan which works for you. Whether you want to study, how many hours will you study? Do you have enough? Like 2 to 4 hours. It's about consistency. And within the week, based on your work schedule and what you do currently, how many days in a week can you study? And be true to yourself and then stick to it. Then, as I said, you are not starting afresh like in nursing school. So focus on like key areas, polish your weak areas, and you cannot go sit for NCLEX and you've not mastered these areas: prioritization, delegation, pharmacology, infection control. Like these are key areas that you should review before you go. And you're not just reading, you have to be doing questions, reviewing rationales, and go through the process over and over again, and you are sure of success. And oh, you have to own the NCLEX format. You can't be preparing for an exam and you do not know what the exam is about. So what is it all about? Okay, NCLEX is a kind of CAT exam, so computerized adaptive test. So if you know this, then when you get some points from a colleague, oh, this is how my exam went, and these are some of, know that the exam adapts to how you answer. So every answer you give changes the next question that will come. So that's why it's called computerized adaptive test. So maybe they are giving you questions on prioritization, they are not getting it too well. So they are giving you higher levels of questions of so the questions will be tailored to your performance. And you may get 85 to 150 questions. And the questions are a lot, different types of questions, select all, drag and drop. So you should have gone through all these different types of questions. That it should not be the first time you are seeing select all that apply, should not be when you are writing the real exam. You should have mastered all of these, the next gen kind of case studies, exhibits, when you have a picture and it's supposed to point out something. So you should go through that so that it becomes your default. And when you see them, you don't panic. It reduces your anxiety. And remember that NCLEX is testing how safe you are to practice. Because you'll be trained when you get your certificate and go through the rotations and all. But they want to be sure that you are a safe learner. So your passing will not be maybe, oh, I got these answers correct, but it's about consistency with safe judgment. So choosing the right answers that will let them know that you are safe to practice. So N is very important that you neutralize the exam fear already. Some people they even see themselves as defeated even before they walk into the exam hall based on what they've heard. Oh, NCLEX can be difficult, it can be tough. Only this percentage will pass and all of that. The interesting thing is that you will get what you think about. So why are you not channeling your energy into thinking right, but you're rather thinking of fear? Oh, I may not make it. What do you think you will get? Because the word of God is, as a man thinks in his heart, so is he. If you think failure, you will have failure. If it says everything in your brain will rewire to push you to do what it takes to get the success. So you have to start mastering your thought pattern. So that's why here at MedCognito, we don't see the exam to be all about content. We also have a portion where we deal with your mindset, coaching you how you can win in your mind and then win on that day. So that's why it's good to join supportive groups and get encouraged. For some days before writing these kind of exams, and some days you are learning, but you feel like you've not learned anything. When you have few days to the exam, you're so demoralized, like what have I been doing? Why can't I answer this question? You have to do that mindset work, and it pumps you up and gets you ready and keep fear in check, because when you are afraid, you shut down your rational thinking, which is done by the frontal aspect of your brain.
Oh, Jesus.
Anxiety gets in. So you can't think about it. Anytime you get so afraid, did you ever think rationally? Like somebody really made you fearful? How was your reaction? So the fear will shut down your prefrontal cortex, which is for executive functioning and thinking. And then it lights up the back side of your brain where your amygdala is. I'm a radiologist, so that's why I'm mentioning all these brain stuff. Amygdala, and it will cause you to have adrenaline so that, okay, you saw a lion. That's not when you're thinking executive. You have to get your flight and fight up so that you can jump and save yourself. So anytime you put yourself in fear mode, that's how you are causing adrenaline to increase and you get so anxious and it will affect your performance. So please start neutralizing your fear right now based on what you think about. Then F, you have to start finalizing your logistics early, because don't wait till the last minute. Preparing for the exam is a lot, and then your processing tool is adding on to the pressure. So you confirm your ATT, your authorization to test. It will come by mail from Person BUE, and immediately you get it, you know that it's valid for 90 days. So you have to be preparing so that it's not like you just receive it and, oh my God, I have 90 days. I have to be prepared for this exam, and you already have pressure. So prepare. Don't wait till the last minute to make sure you have all that they will need, your ID, if you'll be traveling for the exam, your bookings and all, your accommodation and all. Make sure that it's sorted, because it may feel like it's not part of your exam preparation. But if you don't get it sorted, it will increase your accommodation. I remember I was listening to one nurse who had this challenge. She was ready, and I think she even got to the center. She did not have her ID. And you have few minutes to enter and start it. So just missing your ID or missing your location, the exam hall. She's in a new location. The Uber driver is just moving round and round and not finding the place. Like, it will give you a lot of stress. Ideally, you should have arrived earlier, go to the place a day before, know where the exam center is, the room. Okay, this is where I'll be this is where I'll be entering. And then you are assured of all of that, because you may have prepared a lot, but the last minute rush can spoil your day. So please, no last minute stuff. Then you have to ignore new content the day before. Most of the times when your exam is already there, you have like a day, you feel like, oh, I did not study this, I did not study that. And the more you rush to go get new content, the more anxious you will get. So for all that you've been studying, if you've done your planning and you have flashcards, some summary notes, that's the time to review it, but not the time for last minute cramming. You put your brain under stress. And it's important that the day before you get good sleep, relax, and get your bag, have your ID in there. You should have your checklist. What should I have in my bag before I go for exam? How many hours should I report? You should know all of that because the little things can spoil your day. Make sure you're going to be in a comfortable clothing that day. Sleep well, visualize that you're going to be relaxed, you're going to go through well, and you're going to pass. Do not go already with a defeated mind. Then D, know that you are going to take charge of your day. God says that we should dominate. So, and in the area of dominion, exam also is part. The exam should not rock you. You will rock the exam. So you are not going to panic. You arrive early, you've taken something light, you've dressed comfortably, and you'll surely do sessions on like how to the test taking strategies, how to go through the questions and take the right like answers, remove the distractors and all of that. So you'll be able to pick the right answer. So enter the exam board knowing that yes, you are prepared and that you will do well. So E, mostly with the results, sometimes people finish the exam and they are panicking. I see a lot of posts and messages like, I'm done with my exam. When am I getting my results? And someone will say, oh, my exam ended at 85. Somebody will say, oh, mine continued to 150. And people already feel that they did not make it. So whether it ended at 85 or you continue to 150, know that either way you can still pass. So for the Canadian board, you can get your results within 2 to 10 business days. But for US, you can get some quick result, like 48 hours. Some can even, you can pay some check unofficial quick results in 48 hours. You pay about $7.9 and you'll be able to check the unofficial before the official results are released so that at least you are relaxed. But after the exam, please just stay calm. You've done your part. Let the process work and have hope that you will pass. Don't stress over what you got wrong and what you didn't get. I remember in medical school, we had something we call postmortem. We are now going to review like, hey, I did not get it. Which answer did you choose? But oh, everybody's questions will be different. So no postmortem. Postmortem will increase your anxiety. Don't do postmortem after exam. Just thank God for taking you through. Then after you are done, so what next? You pass. That's what we pray for all of you. And then you would receive your license number, then your registration confirmation, and that's when you can have the opportunity to apply for the areas that you want to work with. If you are now moving from your home country, then you can do all of the immigration stuff and get in. But know that that's also the beginning of another journey. You should be ready to continue learning and shine in wherever you will find yourself. And T, lastly, you have to be grateful, be thankful. And when other like junior colleagues or other colleagues reach out, be willing to share your experience. If you train with MedCognito, be willing to come back to say thank you, share your testimonial so that your story, your struggles, and it helps to encourage others. Like I heard from one of our candidates yesterday that she's passed, and I was happy. And it helps you to also know that okay, whatever we are teaching is working, and it boosts your confidence. So it's important that you always do the come back and say thank you to inspire others as well. So yes, you have to be confident. Don't shrink. Don't shrink. You are beginning with the right body. You evaluate your credentials, create a steady plan, know the format. Do not walk into the room and you don't know what you are going to meet. That is disaster waiting to happen. And start neutralizing the fear. Fear will not serve you in any way. Fear will paralyze you. Fear works like a flat tire. It's just deflating you and it will not move. Have you seen a flat tire running like on speed on the road? No, it will just paralyze you and you will not win. And get all your stuff together, your logistics, and a day before exam, relax. That's not the time to go open your Sunday that you are going to read Cushing's syndrome. Get through your flashcards and your summary and refresh. Yeah, you can even decide that you're not going to read anything. Just relax and do what like keeps your spirits alive. Music, deep breathing, and meditation, and all of that. If you're a Christian, that's when to read your Bible, get some music, gospel music plugged in, and get your spirits like high and encouraged. Then, yes, when the results are delayed, don't panic. And the next steps after you pass, you get your license and then start applying for job and always come back to say thank you. So this is a quick glance. We've shared a lot, but I'll just run through it. Make sure step one, make sure you have your licensing body, you've chosen it. You do your credential evaluation, register with the Pearson VUE, then you receive your ATT. Then make sure you schedule your exam and make sure you know based on your education whether you choose centers that are close to you. So even if you are in Ghana, you don't have, there is no test center there, and you have to choose centers that are close, whether South Africa, UK, like whichever test center will work for you, you work on that. Make sure you study effectively, and then you go take your NCLEX. You wait for your results, and after you pass, hooray, congratulations, you start work as a licensed nurse. And if that's not for us, for those who do not pass, they will receive a candidate performance report. So I'll show you how that report looks like. It shows you how you fared in the various areas and the areas that you have to improve. And then they retake the exam in 45 to 90 days, depending on the board you choose. So these are some 10 centers. You can maybe screenshot it, and if you are now looking for a center, I'll share some websites that will help you to locate centers near you based on where so this is for North America, so Canada. There are multiple cities here across the provinces, Mexico City. So these are some centers. So Europe, UK, London. So you can, I think there's this link. Yeah, you can look at these links to locate a center. So they use the Pearson VE test center locator. It helps you to locate a center around you. So you can take a look at these links and then you can schedule your exam. So now that we have an idea of how the exam looks like, let's now spend some few minutes. We will not take long here. Some few minutes to look at what will help us. How will we focus so we can get the out of this exam? So there are four main categories: safe and effective care, health promotion, psychosocial integrity, physiological integrity. So this is the report I told you about. For those who do not pass, they'll get this report, and it's telling you the areas, what is required of you, and then it will tell you, okay, how you fared in that area. So that means that if you are also now going to write it, we are praying, you are not going to get this report, you are going to pass. So you have to look at the areas that you need to master. So you make sure you are covering topics under management of care, safety and infection control, health promotion and maintenance, psychosocial integrity. So that's where we have psychiatry. Psychiatry is high yield for NCLEX. You have to make sure you're on top of your psychiatric game. Pharmacology too is high yield. You know your drugs. Then basic care and comfort. Then reduction of risk potential. That's where we have, I think, of obstetrics, the ANC, and all of those stuff. The physiological adaptation, that's where we have all the systems, respiratory system, gastrointestinal system, neurology. So imagine you don't know what is required of you. And you, for the 3 months you are preparing, you are always studying respirology, neurology, gastroenterology. All that you are studying is under this physiological adaptation. So what happens to the other areas? Your delegation, prioritization. So that's why you should know what is required of you, and then you can plan accordingly. So this table even helps us a lot to know the percentages. So these are the percentages. So for your everybody's exam will be different. The CAT will adapt to how you're answering the questions, but NCLEX loves some areas. And so management of care is so needed. Physiological adaptation 11 to 17, reduction of risk potential 9 to 15, pharmacology is so needed 13 to 19. So you can go sit for this exam and you are not on top of your medications, nursing medications, basic care and comfort, like it's so needed. So for every one of those topics, we have topics that are under it. So I think maybe subsequent sessions, we may dive deep into it all. Anytime we are doing a topic, I'll let you know like which of the categories that they fall in. So we have structured our program in such a way that you master what will be required of you, and you see all the chapters and concentrate on what is needed. Because every one of them have their weight. See, there's 9%. This is 16, pharmacology and parenteral therapy. So you need to up your game, like when it comes to drugs. And then psychiatry. Psychiatry, you can't do without it. So I think that also helps you to plan. So you may be asking, so what happens? So why do people then fail? Is it they do not have the right strategy? I always say that hope is not a strategy. Oh, I hope that I pass. I hope that I pass. No, you have to plan and you have to have the right strategy that will help you to pass. So some may be cramming it, but the test, they want to know how safe you are. So if you are just memorizing things, it would reveal that you don't have depth. So getting to know your content is so important. Memorizing without any strategy will not help you. Some do not know the style, whether they are going to drag and drop, we're going to do case studies. And if the first time you are seeing case studies will be that day, then you're going to be confused. And some too do not deal with the anxiety. So it's like a car left on like free mode and you just go and crash. So start dealing with all of these to maximize your success. So let's go to another formula, which I know will still help us to face this exam with ease. I've said this over and over again. Know your test. You should know what you are going to meet on the day. Have an idea so that you'll be well prepared for it. Like somebody going for a marathon, maybe cross country, and you've not done cross country before, but you believe yourself. No, you will reach. I think within some few miles, you get tired and even go get hypotension, hypoglycemia, and collapse. You should have trained yourself. Those who do the cross country, they do it over and over again. Like they simulate the marathon. So on the day of the marathon, they have gone through it over and over again. And those are the people who win. So know your test and build stamina for it. A plan. By failing to prepare, you are preparing to fail. So make sure that you have a plan and then go according to your plan. And your plan, in getting a good plan, it also helps if you want to work with us. We have the plan for you, the strategies to ace the exam already laid for you, and then you just follow it. And together we achieve that success that. And clinical judgment, I tend to overemphasize it. You need it. because you'll be presented with cases and you have to judge. So it's not about what you have memorized. It's about how you can apply it, because you'll be applying it to a patient. And I said, practice, practice, practice. You should be going through tests, practice tests daily. You choose a number of things to go through, and it helps you to reduce your anxiety, because when you are prepared, your anxiety. So, in knowing your test, yes, you should know exactly what you will be required of. That will be required of you, and build a steady plan. Always factor your weak areas, and work on them. Because mostly you get scared when you see questions in your weak areas. And also make sure you know the amount, like the weight for every kind of system, and then you practice as such. So practice, at least 75 to 100 questions per day. Review the rationales. It's important. Have your notebook, your journal, where you are putting in summaries, flashcards. If you're a candidate and we come to your home should look like a candidate's home. On your fridge and all, you have stuff stuck there in the washroom, everywhere. As you are brushing, you have something you are reading or trying to remember. And make sure you have a day where you rest, because remember, you can do all the preparation the day of exam. You are not in a good state. You are not healthy. Then what will all the effort you put in amount to? So please do well to include rest in your prep, and always simulate the real exam, so that by the time you get to the exam room, your brain already knows, and your brain will be trained to be able to perform under pressure. So it's important that you power your clinical judgment, because this is the report that candidates receive when they do not make it, and they grade their judgments. So see, clinical judgments. How did this candidate recognize cues? So we gave you some vital signs, and maybe the respiratory rate is so high, you did not notice it. The oxygen saturation is not good, you did not notice it. That because if you don't notice, you would not know that this patient needs oxygen. So they want to see how you can recognize cues. So everything you see in the question is there for a reason, and make sure you are not tricked. And when you recognize, okay, how you analyze it, oh, okay, the respiratory rate is high, so this is what I have to do. Oh, this is what I have to do. I have to prop the patient's bed and all of that. So be able to analyze the cues. Then you should be able to prioritize. So priority, that you have a client who needs oxygen, but you are by another client changing the urine bag. So you see, that's so dangerous. So you should be able to prioritize, and then should be able to generate solutions. What do I do next? You then should be able to take the right actions. You should be able to evaluate outcomes. So it's not just about learning, it's about being able to apply what you learn, so that you can make the right decisions and then choose the right answers, because they want to be sure that you are a safe nurse. And this slide will save you a lot when it comes to NCLEX, because NCLEX is testing how safe you are. And NCLEX wants to know whether you can prioritize and treat the right patient at the right time. So you should know your ABCs, which will help you, your Maslow's hierarchy of needs, that you have to attend to physiological needs first, before safety needs, before love and belonging, before esteem needs, before self-actualization needs. So when you know more about your ABCs and your Maslow, it will help you, especially in the prioritization area, that you always look for safety words. First, what's the priority? What's the best option and all of that? And you should be able to eliminate the distractors, and it helps you to be able to choose the right answers. So please trust that your training and help eliminate the fear, because you know that you will surely win on this journey. So this is more about the Maslow. You should not enter exam hall and you've not mastered how to apply the Maslow's hierarchy of needs. It will help you in your prioritization, what to do first for the client, what will make the client safe with me. So you can see this nurse attending to the client to make sure physiological needs, oxygen needs are needed, nutrition, fluid, body temperature, urination, shelter, sex. So all these are under physiological needs before you move to safety needs. So the physical safety of the client, the psychological safety, then love and belonging needs, self-esteem needs, self-actualization. So even love and belonging. So the client wants to make sure that the family are around, but you make sure that the client's oxygen and all of that like are in place first. The family coming around is up this ladder, and you need to see to the physiological needs first. So this is very important. So I put some few questions we just run through so that will help us to know how we would apply this during the exam. So I'll quickly run through it to save time. So this question, a nurse is caring for 4 patients. So these are some of the questions you can meet on a med-surg unit. Which patient should the nurse attend to first based on the Maslow hierarchy of needs? A, the patient crying. The patient is crying and expressing fear about an upcoming surgery. B, patient who has a family visitor and requests to speak to a chaplain. A patient who is hungry and requests a meal tray. D, a patient who with a blood glucose 2.5 millimole per liter and is confused. So you see, we are applying the Maslow needs here. So which of them do you think will be so needed and which of them will save the patient? So I'll just quickly rush in to the answer. Yes, so it's surely D, because low blood glucose, physiological crisis can result in brain injury, coma, and death. So before you go help the patient with their other needs, this physiological need has to be met. That's very important. So we have to make sure that that is sorted. So let's quickly run through this. ABC is a must need. A nurse receives a report on 4 patients. Which one should be assessed first using ABCs? So a patient with asthma who is wheezing but able to speak in full sentences. So able to speak in full sentences. A post-op patient with a heart rate of 110, BP 95/60. A trauma patient with bleeding from the arm and a pressure dressing has been applied. So you see the bleeding, but the pressure dressing applied. Then D, a patient with a swollen tongue, a muffled voice following a bee sting. So you're going to ABC, A, airway, breathing, circulation. So every time your airway is your priority. So you're not going to address circulation. I want to fix the client's line, IV line, circulation, whilst the clients cannot breathe. So that will help you. So the answer surely is D, because the patient with a swollen tongue and muffled voice following a bee sting is an airway issue that can kill the client fast. So you have to act immediately. When you're able to choose the right answer, that shows that you are a safe nurse. So yes, I hope the session has been great, has been helpful. Know that you were born to win. You have come too far to quit. Keep pushing. You are not alone. We are also here to support you whichever way we can. And you are training and you will surely win. And I have this quote I love, which says that tough times do not last, but tough people do. Yes, it's just a season. The season will pass. So yes, if there are any questions, you can feel free to let me know, raise your hand or put it in the chat box. We attend to it. And we also invite you to join the MedCognito group for the real NCLEX experience. We want to win together with you. I will first share we have a free WhatsApp group you can join that. We'll be sharing the freebies. I promise you that if you stay right to the very end, I have some freebies for you. We have some free mocks in all of these areas, key areas that you must know before you go for the exam. So it's a free mock. You can do it in the comfort of your home. Right after you are done, you receive the answers and you can review it yourself. That's a gift from us to you. And we also have some study planners, 30-day planner. We have, I think, 3 months and all of that that I will share inside the group with time. So I would want you to join us inside the group, and then you will surely receive all these. We also have a guide. If you still need help with scheduling your exam, we have a guide. And yes, this free exam prep sheet is so needed. It's a document with the different types of NCLEX questions. And then we have examples of how it looks like so that it helps you to familiarize yourself with the next gen kind of questions. So yes, join us here at MedCognito. We give you clarity, give you confidence, and we have a supportive community to help you on this NCLEX journey. You can get more from us from our website, www.medcognito.com. And you can feel free to email us at medcognitoclass@gmail.com and I will respond to it. So this is the free WhatsApp group. Let me drop it. Let me drop it in the chat box right now so that you can join us. I'm going to drop it in the chat box so that you can join us. But if there are any questions, you can put it in. So we have amazing resources. I'll surely be sharing all of the goodies inside the group. So I want to get you all inside the group. We have paid mock exam you can do in the comfort of your home right after you are done. You get your results and you can review them on high yield areas. We have high yield mock 1, high yield mock 2. We have mock on pharmacology. Pharmacology, when we look at the graph, you see it has a higher percentage. We have psychiatry. So we've done tailored mock so that the key areas that you must review, you will surely be able to do all those reviews right in the comfort of your home. That you know that, yes, I've mastered psychiatry, I've mastered pharmacology, I've mastered multiple high yield areas, like in the high yield mock. And that gives you a lot of confidence. It gives you a lot of confidence. So please, has this session been helpful? Let us know.